Hello, everybody. Good morning. Today we're going to be talking about vital signs. One particular thing about vital signs is how to take a blood pressure. I want to just say a few things about vital signs is that they're really important in determining your patient's status. They tell you a lot about what they're doing physically, and then that might initiate some certain interventions from the nurse to intervene to initiate stabilization if that's required. Okay. If we have low blood pressures, it definitely requires intervention from nursing staff. So for any other instances, we go in and nurses go in every day, they meet their patients, and they go ahead and do vital signs as part of the daily routine. Normally those are done based on physician orders. It could be every 4 hours, it could be 8 hours, or it could be every 12 hours. So it just depends. In nursing homes, it could be once a month. So it just depends on what the doctor is ordering. Typically in a hospital setting, you have about every 4 hours. And part of those vital signs are going to be your blood pressure, your respiratory rate, your heart rate, your temperature, and your O2 set. So you're going to have also pain as part of the set of vital signs. Now, when you get to clinical, we are looking for all those vital signs, and we want them done every 4 hours. Your paperwork, it requires that information. So you'll have to obtain those values and then indicate those values in your paperwork. Between 7 and 8 in the morning, you want to have those documented, and then between 11 and 12 when it comes to the noon vital signs. And you'll obtain all of those, including an O2 set. That's one that typically you will never see, in some instances, being done on the floor. But everything else you will find in the record of the patient's chart. Okay, so what do we need to do for our vital signs to be able to get an accurate reading? Well, we have to tailor the amount of pressure that is required to do a blood pressure for each one of the patients that you're going to do a vital signs on. Okay, and that's typically what I'm talking about, is specifically about the blood pressure. Some people have trained to just raise the cuff pressure all the way up to 180 millimeters of mercury, and then when they get there, if they're hearing some pulsations, pump it up even higher. So in excess sometimes of 200. It depends on where the person's blood pressure is at. That's really not accurate, and therefore we have to modify that so that we can tailor it to everyone as to what their actual pressure is going to be. You don't want to be superinflating the cuff, and then all you're actually doing is driving the blood pressure even higher. So then we're going to be treating a blood pressure that's not accurate, and that could be detrimental to patients. The same thing is on the spectrum of either being too high or too low because we didn't do something correctly. All right. So for each of the patients, typically those that weigh about 7 kilos, about 140 pounds, is somewhere in the medium where we could use an adult cuff. Okay. Now, all blood pressure cuffs come in different sizes, all the way to neonatal or pediatric. So you need to typically find the cuff that is appropriate for the arm circumference of the patient. So if you're put on a blood pressure cuff on your patient, and when you start to pump up and fill it up with air, as it fills up and stretches, if it's too small, then it's going to start coming off the Velcro, and it'll just pop open on you. That's an indication that you have the wrong cuff, and you should go to the next size up to obtain that blood pressure. Okay, so let's talk about how we would do this. So typically, as students, you're going to be going to your patient's room. You're going to check your room and make sure that you're at the right room to do your vital signs. Okay, you already want to know that you're going to be doing them every 4 hours or 8 hours. You already know what that's going to be for you guys. Every day when you're in clinical, it's every 4 hours. Okay, in spite of whether we have an order for 8 hours or for 12 hours. We're still going to do every 4 hours goes by. Now, we definitely will check the patient's room, knock on the door. We gel before we go in the room, and then we apply our gloves as soon as we get in, while kind of introducing yourself and your instructor, because your instructor may be there with you. Typically, you get checked off in skills lab, and then after that, we kind of, once we know that you're able to do that, and we certify that you're okay to go, then we may not be there for that. We'll just say, okay, we'll go off and go do your vital signs, all right? And then you'll go ahead and proceed to chart those in your paperwork. So once I have the introduction, I make sure the patient has a cuff in the room and that it's an appropriate size for their arm. If you're applying the cuff, then and you barely have any Velcro attached to it, then you know you've got the wrong cuff and you need to go find a more appropriate one. So keep that in mind. So we've introduced ourselves. We know there's a cuff in the room. There's a wall-mounted sphygmometer in the room, and that's attached also to the cuff. We have our stethoscope. Now, when we have our stethoscope, when we use it, and this is for manual blood pressures, your earpieces kind of have to angle in away from you, okay? And that's how you want to place them into your ears. You don't want them pointing towards your ears or inward, because that affects what you're going to be hearing. So we need to make sure that the angle is not this way, but rather that it should be that way. Okay, so my fingers are indicating the angle in which they're currently at. Okay, so as long as it's like this that you're seeing here, then you can place them in your ear, because then you'll hear everything that you need to hear to be able to determine what that pressure is. Okay, so once we introduce ourselves, we place our gloves on, then we can go to the patient and say, ask them for their name, date of birth, and we want to raise the bed up to our working level. And we're just going to let our patient know that we're there to do their vital signs. Okay? And then we just let them know if it's okay if I can use the right arm or the left arm. There's certain instances where you're kind of confined to just one arm. One of the things that you need to look for when you go and to do this is to check the armbands on your patient's arms. Sometimes they'll have their patient ID band on one arm, and maybe they'll have an allergy band on the other. Or they could have two bands, the ID band or an allergy band on one, and then on the other arm, they may have what they call a pink band. Okay, that pink one indicates that that arm is restricted and should never be used for either lab work sticks, blood pressure checks, or any other IVs, for example, where you have restrictive bands applied to the arm to be able to start that. So everything typically is off limits when it comes to that pink band on that arm. You don't want to touch that arm for any reason whatsoever. So you got to stay away from it. So then you're kind of left with just the opposite arm as to where you could do something like this. All right, so always be looking out for those things. And then of course, some patients may have only one arm. So then you're really confined to that arm at that point. So there's other options to be able to get a blood pressure. If we can't do it on the remaining arm in that instance, then we can always go to the thigh and do a blood pressure cuff, as long as we have the extremities to where we can do that. And that's just, there's a skill for that, so you'll need to be looking at that particular skill. Basically, there you're using the popliteal artery behind the knee to be able to extract that blood pressure. The systematic method of doing that is not typically the same as for the arm. Typically over here in the knee, behind the knee, you find the popliteal artery. You apply your thigh cuff, that's appropriate size, and then your book will tell you to place your stethoscope down there, and then inflate and feel the loss of that pulse. and then add 30 more to where you last felt the pulse. So, and then you can try to extract. When you give it time to rest for a minute or two, then go ahead and follow through with the blood pressure maneuver and using your stethoscope at that point. Okay, so let's get back to the arm. Okay, so just apply the same principle, I guess, in that instance for the leg, for the thigh. Okay, so we have the appropriate size for our patient, and we're going to let them know that I'm going to do their blood pressure on their right arm, and if I can have their arm, please. This is showing that they're acknowledging what you're doing, and they're giving you the permission to use that arm to do that. We need to make sure that they're doing that. If someone says, I don't want you doing my blood pressure, get out of my room, we can't touch that individual. We can educate them as to why we need to do this, but if they still insist after that, we can't push it. We need to just leave the patient alone and just let them know, you know, if it's okay, later I will be trying and asking you again when it's more appropriate, okay? And then that would be reported to the nurse, that particular situation. But being as they give you the arm, now they're giving you consent, all right? So we get the patient's arm. Now we do have some sites we need to check for pulses, okay? We have the radial pulse, which is on the thumb side of the patient's arm. So we can feel a pulse there. And then we have the brachial pulse, which is on if we find the pit of the arm, and I'll show you on my arm. If I were to put my finger here right in the middle of the arm, and this little nook here, then I should be able to place 1 or 2 fingers there, and then just slightly move to where the bony prominence of the arm is. My fingers are resting on top of it. And then with slight pressure and hyperextension of the arm, I should be able to feel the patient's pulsations, okay? So that's gonna be the brachial artery, and that's the one we utilize to obtain a blood pressure. So, practice this at home. Once you've gone through the skills lab, there'll be opportunities for you to practice this, but then after that, continue to practice. You want to feel the radial pulse go to the thumb base between the lateral aspect of the arm and where you see these ligaments or tendons in your patients. Just go right at the fold, where it folds here on the wrist, and go right in between those 2 landmarks. And just drop the wrist down a little bit, that'll make the artery come up, and you should be able to feel the pulsation. That's the radial artery. And that's where you can do your radial pulses as part of your vital signs, getting your heart rate. Okay, you can do it here or you can do it up here. All right. So once we determine where the pulse is at, then I'm going to take my blood pressure cuff that has an arrow. Sometimes you'll find blood pressure cuffs that have 2 arrows. And then just depending on which arm you're using, then you'll use 1 arrow or the other. So if I had 2 arrows here and I was using the patient's right arm, I would use the nearest arrow, which is this one, towards the middle of the patient, to put that directly in alignment with that pulse on the brachial artery. Okay. So let's pretend here that I would feel that right here. Then I would take my blood pressure cuff and line it up where that pulse is. Okay. So I'll apply this. Well, we want this 1 to 2 inches above where I found that pulse. Okay, so approximately about that far, about 2 inches there. And then we want to hold the cuff in the back. We want to take and just snugly apply, getting clothing in there, the cuff to the patient while still trying to maintain that alignment with the cuff arrow. Okay. All right, so we want a little bit of support here under the arm. If you have a patient's not making contact with the bed, because if you allow them to bend their elbow too much, it's gonna hinder you getting your blood pressure accurately. So we need to hyperextend the arm, support it either with a pillow or with a towel or something that you can place up under here, so it kind of hyperextends the arm. It kind of straightens it out for you. So we'll find the pulse, and then I'm going to take the bolt, and this is predetermining how much pressure I need. So I'm feeling currently a pulsation here, okay? So what I'm going to determine here is the individual initial pressure that I would be requiring to be able to take this person's blood pressure. And this is what I would do for every single patient as I go to do their vital signs, especially with the blood pressure. So I'm gonna hold that, make sure I'm feeling it really good. I'm gonna work with this and tighten it up. Remember, righty-tighty closes, lefty-loosey opens up the valve. And when we do our blood pressure, we need to open it up slowly so that we are dropping the needle on the dial face here at about 2 to 4 millimeters of mercury, which is about as steady as you want to go. Okay, you don't want to have all of a sudden open your valve up here and then your needle goes 20 or 30 all of a sudden, and then you're trying to hold it to get the blood pressure. If that happens, you have to start all over again. So let the air out completely, squeeze the air out of the cuff, readjust your dial, your valve, give it a minute or two to rest, and then try it again, okay? So we're holding the arm, the valve is closed. I'm gonna inflate this, and while I'm doing this, I'm still feeling a pulse, and all of a sudden right there about 140, I lost it. That's the last time I felt that pulsation. So once that happens, all I have to do is just let the air out. So now I know what my pre-inflation is. It's gonna be 140. So what I'm gonna do is add 30 more millimeters of mercury on top of that the next time I inflate it. So I'm not gonna inflate to 140 next time. I'm gonna go all the way up to 170 at the least, okay? So that would be my, you add 30 and you get up to 170, that would be the least amount of pressure. Now, if I happen to feel, because now I'm gonna be doing, the next thing that I do is determine what the blood pressure is. So I have my predetermined pressure for my cuff, 140. I'm gonna grab my stethoscope, because in a minute or two, I'm gonna put this on. I'm gonna take the diaphragm, and now some student stethoscopes, the head can rotate. Make sure that you're on the right side of the diaphragm so that you can hear the blood pressure. One is meant to be able to hear the pulsations in the arm, and then the other ones is more for like listening to the carotids and the breath sounds. Okay, so it's not as sensitive, let's put it that way. Depending on which setting you're on, one is more sensitive than the other, and the sensitive one is what you need to have selected or placed and rotated to so that you can hear the pulsations here, okay? So I have my stethoscope, I have it in my ear, I'm supporting the arm. I'll go ahead, even though I've already done this, I'm gonna go ahead and find my pulsations. I'm gonna make sure that this does not end up underneath the cuff, because it's gonna create all kinds of noises. The other thing is to make sure you don't allow the arm to flex, because you'll hear creaking, just like an old door, all right? So, and that will interfere with what you're hearing also as well. So make sure it's stable, that it's not gonna move. Locate your pulse again, just place it there. And I'm gonna hold it like this. You would never want to hold it like that. And the reason being is because your thumb has a really strong arterial blood flow and pulsation. And so if you hold it here, you can actually hear your own heartbeat in some instances, depending, like as if you just finished running, you could probably hear it, okay, just by holding your thumb here. So you don't want to be checking your pulsations, you want to be checking theirs, all right? So make sure that we're using our fingers where it's less prominent to be hearing that. So we want to make that the way we hold it, and then use the extra fingers to support the arm, okay? So now I'm gonna make sure this is adjusted properly. Don't over tighten, because that's when you try to loosen it up, that's when it goes, because you're not ready for it or you're fighting with it. Make sure it's just tight enough where you can inflate and the needle won't slide down, okay? I'm gonna go to 140 plus 30. I'm gonna go up to 170. So if I go over a little bit, it doesn't matter. I need my, and then right about like that is what I wanna be doing, is releasing the air about that fast. And then I'll probably hear, like right now, 106 is the first time I hear the pulsation. So you record that first number. And then right about here, I get 80, and then I don't hear it anymore. So then I can just let the air out. So the first time I heard it was at 130, and then the last time I heard it was at 80. So my blood pressure on this patient is going to be 130 over 80. And so it's the first sound you hear with the stethoscope on, and record that number. And then the last time you heard it with your stethoscope, and record that number. First one's for the number on top of your blood pressure. And then the bottom one, or the last one you heard, is the bottom number of your blood pressure. And those are the numbers you're going to record in your paperwork. And that if they're abnormal, there is a range, it's considered normal. And if you're falling out of those parameters, you'll need to report that to the nurse, okay, when you're in clinical. So once we're done with that, then that finishes the way we do our blood pressure. Then we can just take that off, deflate it, place it back, and then cover our patient up. And we can continue to do our vital signs. I've shown you how to do the blood pressure. One of the things that you need to, however, remember is when it comes to doing your vital signs is that you want to do your pulse, radial pulse or heart rate count first before you do the blood pressure. Because that will alter how your blood pressure, your heart rate is going to be counted, and you don't want that. So do the radial pulse or heart rate first, and actually right after that or just before that, you want to do respiratory count. That way your patient doesn't know that you're doing that. Otherwise, they're going to hold their breath and mess with you. They're going to want to play tricks on you. And some patients are really good. They know quite a bit already. They probably know a little bit more than you do at this point. So if they've been in the hospital several times, they probably do. And if you're a student, trust me, they will test you and they will want to see how much you really know. So I would pretend I'm holding and getting a radial pulse for the heart rate, but I'm actually, right off the bat, I'm looking at their chest, pretending I'm counting, but I'm actually counting this. And I see the chest rise up and down. Every rise and fall is one breath. And you do that for a full minute. Okay, and so that would be your respiratory rate. As soon as that's done, or I'm done with that count, then it's when I start to count this. So I would do that for another full minute. And then I have my respirations and my heart rate. Then I can go ahead and proceed to do my blood pressure and my temperature and my O2 set in that more or less particular order. Okay? So I hope that is more clear. I know your book discusses this, but it doesn't always, it's kind of hard to picture that. So I've just presented it to you as to how it should look like and how you can practice and what we'll be looking for when it comes to the skills checkoff for your blood pressure skill. Okay, so review this video as often as you can to remind yourself about how to do this. If you have any questions about this particular procedure or skill, be sure to contact your instructor, and hopefully they'll be able to answer your questions as to what that will be. Thank you for your time, and we'll see you down the road.